I went to the Pursuit of Truth, another one made during the strike. This is about assisted dying, and I've covered it before when Esther Ransom brought it up. But I think it's going through the courts now. I don't really know what to think about it. It is a difficult one. Obviously, since my mum's passed, I've been thinking about death and mortality quite a lot. I haven't covered it so much in the Pursuit of Truth, but it's been constantly in my mind, and worrying about death and worrying about those that are left behind. I've got a poem that I haven't read out called that, and all those types of things, and wanting to live to see my kids grow up and not wanting them to suffer if I die when they're young and all that kind of stuff. That's just plaguing my mind at the moment. And this idea that when you get sick and you have a disease that is incurable, though, of course, if we all work together as one, we could maybe get closer to these incurable diseases rather than doing it for money and competition and competing, which is what the medical industry, well, what seems to be our system, because lots of medical industries make money out of patenting things, and other than COVID, and I don't know even if it was during COVID, did they actually share information so that they can work together, different companies around the world all working together, pulling together there so they don't have to compete with each other and make different brands and different things. Use that research, use that mind power to fix the world of all these diseases, take money away from medicine, which is what our system has, and that's the problem with it. And that leads to all these other things like the prima dossi issues and all that kind of stuff. But yeah, assisted dying is a difficult one because it could be misused. There could be elderly people that don't want to, put trouble on their kids and just decide to die, or they've had enough. And is it, because then the state wants to have an opinion of our lives, and are we free to make our own decisions? What if we do decide? But then, of course, what if there's people with mental health issues or people that feel forced into it or are forced into it by coercion because they're mentally incapable of making that decision, capacity and all that kind of stuff? There is that worry with assisted dying, and whether we should all have the right at the end of life. Maybe there's nothing wrong with you, but you're just got no one left, or you're tired or depressed, but then is that your choice or not? I don't know. It's a very difficult one, but just seeing these people suffering, for those that are actually suffering, that have a medical condition that currently can't be cured, and they know that they're almost certainly going to die and they're going to be robbed of life. The problem is that moment when you make that decision before you get to that is probably the problematic thing. But I don't think anyone really wants to see their loved ones or be the person to suffer and forget everyone around you, like dementia does, or cancer, where it kills you, or that kind of things. Anyway, I'm going to play it now.
Very content, don't they? Ashish is here to talk to us about assisted dying and also about palliative care.
Assisted dying takes a huge step towards a debate which could see assisted dying becoming legalised in this country. Today, the bill will be introduced into Parliament later this afternoon. But before then, there is a lot of worried discussion taking place about the state of palliative care in this country. The hospice sector is under severe strain. Funding is at crisis levels, and we've seen at least one hospice close its doors to sick and dying patients in the last few weeks. Palliative care doctors, many of them are opposed to assisted dying because they say palliative care in this country needs urgent intervention because people are dying long, painful, lingering deaths. So before any conversations can start taking place about assisted dying, we need to have a very good look at ways to improve end-of-life care in this country for patients who need it. I spent a day with staff and patients at a hospice in southeast London, and these are some of their stories.
Hey, Tim.
Tim was given just a few months to live. That was 3.5 years ago.
Let's see what, Tim.
Born with learning disabilities, he later developed cancer, and it kept returning.
You be there? Hello, Tim. It's lovely to see you.
But despite being very sick, Tim can live at home with Mum Valerie because of support from his palliative care nurse, Phoebe.
This is Joe.
It's really sad to see him deteriorate, particularly because when I first started seeing him, he was independently mobile in his wheelchair. He would take lots of videos. He'd be super, super chatty. I'm not going to lie, I do cry quite a lot at work. I think you're human.
Which flavour would you like?
Valerie is 82, and naturally, she's worried about the future.
I think if you speak to any parent of a child with learning disabilities, well, all those that I have known have said, I would like my child to die before me, because we've seen so many go into care, lovely people there looking after them, but then you go back a few months later, those lovely people have gone and there's somebody else there.
Would you be able to cope without the palliative care you receive?
I couldn't do this without them.
Breathing.
The quality of the country's end-of-life care system is being questioned as MPs consider legalising assisted dying. St Christopher's Hospice, where Phoebe works, neither supports or opposes a change in the law. But the hospice sector is a strong and important voice in that debate.
We've got hospices who are cutting back their services already, making frontline staff redundant because they're no longer able to fund those services. And so whether or not assisted dying is introduced by this government, we must fix the end-of-life care system in the UK.
Her catheter bag would be full of blood and they wouldn't come out.
Linda has experienced the best and worst of end-of-life care. Her mother died peacefully and comfortably at a Marie Curie hospice, but her Aunt Mary chose to die at home.
We had to buy her incontinence pads, we had to buy different creams because the deliveries weren't regular. We had to chase everyone for everything. And it's just so tiring all the time having to fight.
In the UK, we don't talk about death enough. But now, that conversation is being forced on us, and it could be one of the most important ones we ever have in our lives. Ashish Joshi, Sky News.
And you can see more of Ashish's special report on end-of-life care on the UK Tonight at 8, or scan the QR code right now.
It's a difficult one, isn't it? Because obviously we don't want, obviously there'd be people worried about the state having an input in this and thinking that, or maybe they're doing it just so to ease the pressure that's on hospitals and care homes. And of course that'd be the worry also, that if the care homes are failing with funding and doing all these things, and that they have that option, and that people, they're suffering because the care home isn't funded properly, isn't done properly, and their medical condition, if treated properly, would have a better care of life for them and longer longevity for them, then that's the issue with having this assisted dying, is that it could be misused, I guess, in that way, because there could be systems where it's poor. And also we know that it's a difficult medical decision to make. Someone would have to make it. And can you guarantee that the person making, the having to sign it would be a doctor, I assume? Vast majority of doctors, I assume, are great, but we have had cases where, these powers have been misused, Harold Shipman and etc. And what the problem there would be. That's I guess the big dilemma with introducing this. At the moment, we don't have to worry about that, but the problem is for those people that are suffering, what for them? But yes, I guess the big problem is that if our care system, or around the world's care systems, are all failing and not being funded properly, and people are being left to suffer where they shouldn't be, and if they were treated properly, they would have a better existence, then this is where the issue would be. If you had this policy that they could then opt to take their life instead of going through the suffering. But that would be the wrong answer in that regard, because it's because of the failure of the system or of the care home or of the hospital that's leading that person to make that decision, which they wouldn't otherwise make that decision if everything was better. And yes, we don't live in a perfect world, but then this is the problem, you see. When you attach things to money, then this is what's always going to happen, these decisions to be made. But if we didn't, we got free will to do whatever we want. If we didn't have that attachment to money, work together, we wouldn't have to have this. Anyway, take care, take it easy, God bless, and peace.